Hi guys, I'm Nico and today's video is about how to spot lameness on a horse with Dr. Matt Elliott. My horse Sirius got down sound, so we call our vet, Dr. Matt Elliott, and he gave us a veterinary masterclass. We are going to show you how to use hoof testers, how the horse walk when injured, the difference between concussive and swinging lameness, shoulder, knee, fetlock, flexor, and suspensory ligament tests. And stay until the end to find out what kind of injury Sirius has and the proper rehabilitation that we're going to do. Now let's start. This is the first thing we learn today.
Now here's good to know, 90% of the lamenesses in the forelimb of the horse are below my hand. And 90% of those have everything to do with the size of the foot. So if I think the horse has maybe a bruise or an abscess or some sort of foreign body in the horse's foot, I would take the hoof testers and I would go looking around. I would squeeze over the toe. And what would the horse do if this hurt? They'd pull back, correct. And now those are the flies, but this is no response. This is called a quarter. You guys need to learn your anatomy. This is the toe, the quarter, and what's this? The heel. Good for you. So I can go all the way around the horse's foot looking to see if the horse is painful.
Okay, he passes the hoof testers. Now, how do we know which leg is lame?
This is what a horse will do. Pony Club 101 says the head goes up when the lame leg goes down.
Very clear. Do you know there are different kinds of lameness? Let's hear about it.
So the concussion or concussive lameness happens when the horse puts the foot down and the horse says, ouch, that hurts. Ouch, that hurts. Ouch, that hurts. So that's when the head goes up and the lame leg goes down. So horses should travel symmetrically, even. But when they have a swinging leg lameness that often involves a tendon or a ligament, this is what they'll do. They'll come up short. They'll say, ouch, that hurts. Instead of, imagine their tendons and their ligaments, particularly their suspensory ligament, is like a rubber band. So if as the suspensory ligament goes to stretch and reach, if it's injured, the horse comes up short. So two types of lamenesses. What's the first one? Concussive, meaning that if it's a joint, it hurts when the horse puts its foot down. If it's a swinging leg lameness, here you go, don't lose that. The horse comes up short.
Now that we know the difference between concussive and swinging lameness, let's see if we can see it on the lunge line.
Now you guys need to determine, does this look even, balanced, symmetrical? I think it could look a little bit better. Something's not quite right. So Lisa, bring him on over here and we're gonna do some flexion tests. You want to pick up the horse's front leg, it's your fingernails over his cannon bone. So here's the shoulder joint, which I'm going to bring out in front. Does that seem to bother him? No. What about when I pull it back? No. To the side? No. Here's his knee, and his knee is like the back of my hand in that it has 3 joints to it. And I can push and press, and if he was uncomfortable, what would he do? He'd pull his leg away, correct? Yes. Now this next one, this is what they call the Fetlock flexion test. I'm going to take this bone. What's the name of this bone? His cannon bone. I'm going to take his cannon bone and take his foot and bend and see if he thinks this feels uncomfortable. These are his flexor tendons. That doesn't seem to bother him. Right behind his cannon bone, what's the name of this ligament? His suspensory ligament. So I'm going to push his flexor tendons off to the side and press down on his suspensory. I'm going to push down on his suspensory. What do you guys think? Is that uncomfortable? I think so too. Now we have to make sure it's not just flinchy, but we have to make sure that it's consistent. So I'm going to move his flexor tendons off to the inside and press down and press down. This is his middle suspensory. This is the lower. He seems more sensitive at the upper end of his suspensory. And if I hold on to this long enough, what do you guys think? That's how a horse says ouch. So he's a little painful on that left front suspensory ligament. Would you guys all agree? I agree too. Now you guys might not be able to see this, but he's lame, and the grading of the lameness is 0 is normal and 5 he's non-weight bearing. He is 1/2 out of 5 lame on his left front on a 20-meter circle going to the left. Pretty subtle, not easy to see.
Do you see the swinging lameness? So Sirius has a suspensory injury.
Are you serious?
Now, what do we need to do?
Suspensory ligament issues, there's no swelling. There's nothing to tip you off that something's wrong with the leg. Now we're going to talk about how would you rehab this? How would you rehabilitate the horse? What would you guys choose to do? Would you give him a whole bunch of bute and gallop him around? No. What else might you consider doing? Well, what do they do in people? What is the RICE, the acronym in people for injured tendons and ligaments? Rest, ice, compression, and elevation. But you can't elevate the horse's leg, can you? No, but you can rest them and you can ice them so they have what they call ice boots. And that's what this horse needs on his left front leg.
Rehabilitation for suspensory injury. No painkillers or anti-inflammatories. Walk on the saddle, rest, and ice boots. 20 minutes, 3 times a day. So that's it for the video. I hope you like it. Hit that like button, leave a comment, share it with your friends, and please subscribe. See you next time.
Dr. Matthew Elliott here with Twin Oaks Veterinary Services, and happy to help with your horses as best I can.